Tonight on CBC Vancouver News.
We have 7 new cases in British Columbia.
BC's COVID-19 infection total rises to 39. Also,
right now, our hospitals are all over capacity.
Is BC's healthcare system prepared for a mass outbreak? And
all right, so we're seeing a bit more of the germs.
how to really wash your hands to prevent the spread of COVID-19.
This is CBC Vancouver News.
good evening. Another day, another increase in the number of coronavirus cases in BC.
This time, 7 more people have been hit, bringing the total number in our province to 39.
Dan Burrett is live with more on this. Dan, tell us about the new cases.
2 of those are healthcare workers at the Lynn Valley Care Home. Another 2 cases appear to have been contracted through what's called community transmission. Both patients there are isolated at home, and doctors are trying to figure out the source of their illnesses. 3 other new cases involve travel. A woman who recently returned from Egypt, a man who was in Germany, and another who was on the Grand Princess cruise in February. Now, lots of parents, speaking of travel, and students are preparing to travel for spring break and wondering if they ought to go. A provincial health officer urges people to know which countries to avoid.
Be very aware of where you're going. There are travel advisories that Canada has put out, including one that that advises against travel on cruises and travel to certain countries in the world. I would adhere to those. I think travel within Canada is still very safe, and certainly here in BC, it's very safe.
Henry adds, because of the outbreak in Italy that has essentially shut that country down, they're now asking anyone returning to BC from Italy to isolate themselves for 2 weeks, the same as travelers from Iran and China's Hubei province.
Okay, Dan, we've also seen a surge of coronavirus cases just south of the border in Washington state. What are British Columbians being told in terms of actually traveling to Washington state? Yes, 74 new cases, Anita, and 2 new deaths there. We know that it's been concentrated at the Kirkland Life Care Center near Seattle. Dr. Henry says they are having unrecognized transmission and outbreaks in that state, and people need to be aware and, as we've heard from her earlier, take some basic precautions.
Certainly not travel if we're ill ourselves, and if we are somebody who is at high risk of having severe illness or dying from COVID-19, to reconsider travel to any of the areas where we know this might be a risk. Otherwise, taking our usual precautions, but being a little extra careful, staying extra distance away.
And back here in BC, there was a lot of news at this news conference today. If there is a glimmer of good news, Dr. Henry says a woman who was in ICU in critical condition at VGH who had coronavirus is now stable and at home. Anita, Mike?
All right, Dan, thank you.
Another private school, this one near Victoria, is closing early for spring break because of a possible case of the virus in the school population. In a letter to parents, someone in the Glen Lyon Norfolk school community in Oak Bay fell ill recently, and based on their travel history, has been advised to self-quarantine at home, awaiting COVID-19 test results. The letter says the sick person attended the school for a significant period of time this past week. Both school campuses will be deep cleaned before reopening March 31st. Yesterday, Collingwood School in West Vancouver announced it would be closing early after learning one of its families was in close contact with a COVID-19 patient.
Okay, as COVID-19 continues to spread, local health officials are promising pandemic preparations are underway.
But do our nurses and doctors think we're ready? Our Leanne Young went to find out.
Not one N95 mask left.
Only masks we have left are these, which are not protective.
That's just part of the struggle Dr. Miriam Zainadine says family doctors are facing in battling COVID-19.
You have to have a mask, you have to be able to have a gown, and we've had, put some of our staff and doctors at risk, even going out in the car and testing patients potentially.
Staying outside to avoid bringing the virus into waiting rooms. The federal government has said it's working on a plan to secure and distribute supplies. Even if that were to happen, she thinks the better solution is triaging centers, designated places for anyone with flu or coronavirus symptoms.
Because otherwise we're putting all patients at risk, including all the physicians, community care physicians, including family doctors and their staff, and all the other non-COVID-19 patients at risk.
The province's medical health officer says local health authorities are looking into the idea and in the meantime trying to support clinicians where they can.
In other communities, they're looking at more innovative ways to make it easier for people so that they can come in on a set time and not have to be in a physician's waiting room, etc. So those discussions are ongoing.
The people responsible for supporting doctors are also concerned. Nurses say they are overworked.
So we were struggling already. Nurses work about $162 million worth of overtime. That's the numbers we have from last year. That's about 2 million hours of overtime.
Sorensen says they've sounded the alarm for years, and the nursing shortage will only be exacerbated by COVID-19.
If we have large numbers of patients who are positive for COVID, who require acute health care in an ICU or an emergency department in an ICU, that's the concern, is can we manage when we already have a healthcare system that's at 100% capacity?
There's no quick fixes, but both Dr. Zainadin and Sorensen say the community can help, slowing the spread of the virus by washing hands, avoiding large groups, and staying home when sick.
Nurses, of course, will be ready when patients come into acute care, into our emergency departments, but we would like that to be a trickle and not a flood.
One of BC's largest unions is asking employers to drop the requirement for doctor's notes.
It's a huge burden on doctors who should be caring for sick patients and not filling out doctor's notes.
They're hoping it will remove another hurdle as we all do our part to stop the spread. Leanne Young, CBC News, Burnaby.
And dentists are worried about the shortage of masks in light of the coronavirus outbreak. They're being warned if the shortage continues to grow, hygienists could be laid off and your next dental visit canceled. Dentists and hygienists are required to wear a new disposable mask for each patient to protect themselves from splashes and sprays from mouths. The BC Dental Hygienists Association says some clinics may have to reduce hours or close altogether if the shortage continues.
As supplies decrease, it's harder and harder to get supply into dental offices and dental hygiene offices. The problem is dental hygienists, dentists, all our healthcare providers really can't practice without masks.
As the worldwide shortage continues, health authorities are urging the public to stop buying up masks as they are virtually useless against the virus.
BC's premier is telling business leaders the provincial government is preparing for the worst when it comes to the coronavirus outbreak.
Companies are being urged to prepare as well because, as Tanya Fletcher tells us, John Horgan says it's likely the economy will suffer in the short term.
No shaking hands, just bumping elbows. It's Premier John Horgan's new personal greeting in the wake of COVID-19. He was there to sell his government's freshly tabled budget to Surrey business leaders, and yet in his opening remarks,
I know that all of us are thinking now about COVID-19 and the response of the government of British Columbia, the government of Canada, and indeed the international community.
He told the crowd the ripple effects of coronavirus will be felt by local businesses.
Whether it be in service delivery, whether you're in manufacturing, whether you're in the delivery of other product to consumers around the Lower Mainland, it's going to have an impact.
And that's particularly worrying to industry south of the Fraser, home to the most manufacturers in the province.
They're concerned about different supply cycle impacts. It's already happening. They're making goods in China. Can they get those goods over here? We're seeing a market shift, a global market shift. And we're seeing that some businesses are not prepared.
As for the province's role, Horgan says all governments can do is prepare for the worst and hope for the best.
We can anticipate economic disruption. The challenge for governments is that we can't predict from moment to moment where those consequences will be. Cruise ships are a federal responsibility. My local mayor has been phoning me like every other day saying, when are you going to stop the cruise ships? So I don't stop cruise ships. That's not my job.
I believe that more needs to be done. I know that there's plans and response strategies in place, but no one really knows what those are.
She expects businesses will begin to notice a hit to their bottom line within about 6 months. As for the Premier, he says he'll be discussing this with his counterparts from across the country at the First Minister's meeting later this week. Tanya Fletcher, CBC News, Vancouver.
And we'll have more on this developing story, including the extraordinary nationwide lockdown in Italy, later in this newscast.
A woman is in custody as homicide investigators look into a death that happened at a Coquitlam park early this morning. RCMP originally responded to a small suspicious fire in Minikata Park, but once there, they found evidence of a suspicious death. A woman was on scene and arrested immediately.
And Surrey RCMP are ramping up efforts to track down an alleged kidnapper and human trafficker.
The hunt to locate and arrest Norelden will now be intensified as people from all over the country will be on the lookout for him and ready to claim a $50,000 reward for information leading to his capture. 22-year-old Mayaz Norelden, who goes by the name Streets, was charged with a number of offenses back in August of last year. Those include kidnapping, unlawful confinement, aggravated assault, robbery, and firearms offenses. The $50,000 reward is being offered in collaboration with BOLO, a program that amplifies police most wanted and priority investigations. Anyone with information on Noor Eldon is asked to call 911 Surrey RCMP or Crime Stoppers.
And now we go to Brett Soderholm for, I think, some not so great news if you don't like rain and cold.
Yeah, it was definitely a contrast from yesterday, wouldn't you say? We had all of our sunglasses out on Monday. Today, it was a matter of bundling up. And honestly, Anita, I thought of you. It was chilly out there, and I think I needed a warmer jacket than what I ended up wearing today. We're looking at some cloud cover all the way across BC right now, and that trend is going to be continuing for the next few hours. And if we zoom in a little bit closer, yeah, we're going to be getting into some more shower activity. In fact, it is already raining in downtown, and that trend is going to be continuing as we go through the next little while. But there is going to be a little bit of a silver lining in all of this. It's going to be a little bit of a chilly evening with temperatures right now seeing as about 6 degrees or so. We will eventually be doing much better than this tomorrow. All across the region, we've struggled to really get above 7 degrees, and that means that it is still technically winter. But when we look ahead to what we can be expecting over the next little while, a couple of good things you're going to notice. There's still a risk for these showers first thing by about midnight tonight. As we get into tomorrow morning, though, it's going to be a bit chilly, but we're going to start to see some of that sun come out. And by the afternoon, I'm willing to bet here we are going to be seeing full sun all the way across the region. Temperatures pretty well where they should be, and that trend is going to be continuing right into Thursday. Now, that said, winter is still hanging on in other portions of our province, and that includes parts of the Coquitlam Highway if you're going to be traveling over there. So I'm going to have all of those details about winter when I come back.
All right, thanks, Brett.
Yeah. Okay, here's the deal. You can also watch this newscast live on CBC Gem. The free app is also where you can find other CBC programs.
CBC Vancouver, also on Facebook, YouTube, and Instagram.
Coming up, 1 year after the deadly crash of an Ethiopian Airlines flight, where does Boeing's 787 MAX stand, and what victims' loved ones are focusing on instead?
Thank you, as always, for watching online, where we are ad-free during the TV commercial break. There's a looming labor shortage in Canada's marine shipping industry, and it could affect 90% of the items we buy, wear, and use.
Now, industry experts are working with training centers to try to fix the shortage. The CBC's Brett Ruskin visited a center where students can see their futures on the sea.
Without this industry, you wouldn't get your breakfast cereal in the morning.
From cereal to supercomputers, it's all shipped in boats like these. But the workforce aboard these ships is aging. 20% of workers are expected to retire in the next 5 years, and some deliveries have already been delayed with no crew to move the ships.
We have this huge gap of people now that have decided that they're going to retire, and we just can't fill that gap now.
Captain Gary O'Donnell is a pilot. He helps ships navigate ports.
So are you retiring soon yourself?
I'm retiring from Halifax as a Halifax pilot in next year.
You're kind of part of the problem, right?
I guess you could say that.
The solution could be here, Cape Breton Island at the Nova Scotia Community College's Nautical Institute. These students are seafarers in training, in the pool and at the helm of a virtual ship.
And it has everything in here that we can practice without breaking anything, so we know what we're doing when we actually go on the boat.
Companies are so eager that one already offered him a lucrative job and agreed to pay the rest of his tuition.
Most of our students, they are chosen after first year, and the industry, they want these students to work with them for the rest of their lives.
For women or Indigenous students, the federal government offers $5,000 towards tuition.
And it definitely showed in numbers this year. We had like 10 girls to start with in the class, and they've never had that before for marine engineering. Usually it's like 1 or 2, maybe 3.
Well-paying jobs, high demand, and offers of free training. Still, experts say the marine industry simply isn't top of mind for high school graduates.
And there's less people interested in going into it at the front end, often just because they don't know about it.
And so industry officials and the school are trying to get the word out there that there are opportunities available in the marine industry. Brett Ruskin, CBC News, Halifax.
All right, well, stick with us. We'll have more on what's making headlines across the country, around the world. Also, more on COVID-19.
Yes, and...
oh, yeah.
Well, how many times have you heard health officials over the last, several weeks? Wash your hands, wash your hands. Sounds simple, but what does it actually mean? We're going to do a little experiment right here at CBC, and we'll have that coming up a little later. Stay with us. It has been 1 year since the crash of Ethiopian Airlines Flight 302. All 157 aboard were killed, including 18 Canadians.
Ethiopian investigators lay most of the blame on Boeing for design flaws in its 737 MAX 8 software.
But as Susan Ormiston reports, family and friends are focusing on the lives lost and how to commemorate them.
1 year ago, Ethiopian Airlines Flight 302 dove into this field after leaving Addis Ababa, 6 minutes in the air, and then it plunged into the ground, leaving a huge crater. Today, that crater has been all filled in and leveled off, and there's a team of workers painstakingly still picking up bits of metal and wire from around the site in preparation for the 1 year memorial. More than 100 families have come back to Ethiopia to remember the people they lost here in this field, including many Canadians, and we've spoken to nearly all of them. One brother saying he's here to feel the presence of his sister and his 5-year-old niece who died in this field.
You get fresh memories of everything, and it's overwhelming. And you see yourself, sometimes because of these memories, just crying on your own.
For them, this place has become a graveyard, and they want a permanent memorial here. It's still under discussion. Currently, there's a fence around the site with barbed wire and stakes in the ground, still trying to decide on a design. In the fall, the Ethiopian government actually buried some coffins here. They held remains that were too tiny to be identified, so they are here in this sacred place. And the families deeply want this to be remembered forever. They also hope that their year of advocacy, pushing on Boeing, on the FAA, on the Canadian transport system, has produced some results so that their loved ones' deaths are not in vain. Susan Ormiston, CBC News, near Bishoftu, Ethiopia.
Well, officials at Canadian airports are paying special attention to travelers returning from countries hit hard by coronavirus.
Throughout the year, officers are always on the lookout for people trying to bring illegal food into the country, intentionally or not.
David Burke explains why they are especially concerned about pork.
Bella is a Canada Border Services Agency detector dog. It's her job to find illegal food, plant, and animal products. In a day, she can sniff hundreds of bags.
Here at Halifax, we find stuff on a daily basis.
And what is the #1 thing they find?
Mainly pork products. That's what we see the most of here. And Bella works really hard to find those. It's one of her favorites. Dried cuir sausage, a lot of pâtés and different things like that. We see a lot of hams.
Most meats from countries other than the United States are not allowed into the country. Out-of-country pork is dangerous right now. Many countries have been hit hard by African swine fever, a deadly virus that can devastate pig herds. Foot and mouth disease is also a threat. They're not harmful to people, but could really hurt our pork industry. So far, neither disease has arrived in Canada, but they can be transmitted on pork and in soil.
And we don't want that coming into Canada. So as a detector dog handler here at the Halifax airport, it's Bella and my job to stop those pork products and those soil products and different things to come in to protect our pork industry here.
This year in the Atlantic region, CBSA has confiscated 700 food, plant, and animal products. More than 300 of those confiscations were at the Halifax airport.
Make sure you declare any food, plant, or animal products you're bringing in. If you declare them and they're not allowed, you forfeit them to us and we will dispose of them. If you do not declare, there can be up to $1,300 penalties and possible prosecution.
Daigle says people should check out the Canadian Food Inspection Agency website to find out what's not allowed to come into Canada. David Burke, CBC News, Halifax.
Well, some property owners in Toronto are dealing with a costly mystery. Clothing donation bins set up without their permission that they now have to pay to remove.
As Lauren Pelly reports, officials say it's a problem right across the city.
This is the latest mysterious bin. Big, green, and illegal.
We first noticed it when we got our first citation from the city to remove it.
That was more than a year ago. Since then, the owners of the Masonic Temple have spent thousands of dollars dismantling bins just like it. But new ones keep popping up, and the city keeps fining the temple.
We see it, of course, when it comes across our table because we've got to pay the bills and pay whoever we had to remove it or deal with the city ordinances to stay within compliance. So our board is got bigger fish to fry than constantly dealing with a clothing drop box.
The temple president says he's called the number on the side of the bins to track down who owns them, but no one answers. According to the city, at least 200 unregistered donation bins are scattered across Toronto. That's making it tough for city officials to crack down.
What happens is they're removed either by the property owner or by us, and they're back in 3 days. So that's a challenge that we're going to have to deal with.
That's not to say that the city won't be sensible and sensitive to the situation and work with property owners, and in particular in circumstances where they are being victimized by companies that are putting the boxes without permission.
This councillor says he's asked city staff to ease off on issuing citations to the temple until a solution is found.
We've contacted the bylaw enforcement office to try to let them know that the circumstances complicated in this case, and we're all working towards a solution.
In the meantime, the temple's president says passersby also need to take precautions.
It's not a charity by any means, so I would warn anybody looking to drop their clothes off at a clothing drop location to pick a registered charity, something like the Salvation Army.
Lauren Pelly, CBC News, Toronto.
Italy's first full day under total lockdown. There's immense pressure on the country's hospitals. How Canadians stuck there are faring. That's next.
Some people call this fun. Rhonda Heaslip calls it her life. Heaslip can be called Canada's strongest woman. At 123 pounds, the Parksville powerlifter holds the record of 869 pounds over 3 lifts.
Is that a new record? Yes, it is.
Heaslip has done plenty of celebrating over the years. She began powerlifting 16 years ago at the age of 20.
And I held all the Canadian records 6 months after I started weightlifting, took champion of champions, and 2 months after that I was third in the world.
But she has never been number 1, and now at the age of 36, Heaslip is giving it one more try. She has 3 kids, a part-time job, yet trains full-time.
We work together around the house, share the housework, cooking, duties, looking after the children. She works an evening job, I work day shift. That helps to keep it together.
It works out well. And I think too, it's a good example for my kids to see someone go for something special and follow through and make it happen, because in their lifetimes they're going to have to do a lot of that if they want to be successful adults.
Those World Championships are in Tokyo this May. We'll keep you posted. Bob Nixon, CBC News. After a hard week of work, who doesn't occasionally think about quitting the hustle and bustle and doing something you really love? Something quiet, reflective, enjoyable. And did you know there really are people who have such jobs?
My name is James Yu. I'm the restoration coordinator at the Sun Yat-sen Garden. I have been working here for over 18 years. This is the first classical Chinese garden built outside of China. From scratch-wise, this is the first one in 300 years. You walk through the gate, it's like you walk back in time and space. Everything you see here, right from the ground and up, so they're all imported material from China. The place is constantly changing in its scenery, because there's a lot of shadow at play. Different time of the day, different hours, you get a different perspective of the place. In the summer, we do the gong around noontime, and the fish is being conditioned to come for the feeding. In the midst of the winter, food is the secondary thing, Survival, I think, survival more. Sorry to say, the moths are here to stay, So the rooftop, the ground, you can see is pretty green. So our job is to try to keep it at a controlled state. But certainly it's an ongoing project. It's almost like changing light bulbs from one end of the bridge to the other, right? So by the time you finish, you got to start all over again.
The coronavirus outbreak is accelerating in Canada. In Alberta, the number of cases has doubled to 14.
Here in BC, 7 new cases today, bringing the total here to 39. Many of the new infections are related to overseas travel.
But as Tina Lovegreen explains, 2 of them appear to have spread locally.
At the care home where Canada's first COVID-19 death was recorded, 2 more cases, both healthcare workers.
They're both in isolation at home. There's been a number of testing being done on people with symptoms.
Health officials are still investigating how the virus made it into the care home, and now 2 more cases of apparent community spread are under the microscope.
These people are in isolation. We know they're close contacts. We can stop those chains of transmission so they don't continue in our communities.
There are more cases in BC, now a total of 39.
Some positive news, but of course some really challenging news for the families involved.
Some have recovered, including an 80-year-old woman who is being cared for at the hospital. But just across the border in Washington state, more than 70 new cases in just one day.
So the number of people who are infected in an epidemic like this will double in the state of Washington unless we take some real action here.
The virus has been detected at 10 different long-term care homes, causing 2 more deaths. New rules at Washington care homes have been put in place. Each patient is limited to 1 person or visit per day, and every visitor will be screened for the virus.
Talk about seniors who are living in care home setting, they are more vulnerable.
There are worries the same kind of spread will happen here.
I'm concerned because we know that care homes is the home for many seniors, in particular those who are more frail, and that number at this point may even change further, so it is a concern.
But with BC doing more testing, officials are hopeful they'll stop the spread before things get out of hand. Tina Lovegreen, CBC News, Vancouver.
Italy's extraordinary nationwide lockdown began today. Authorities there are struggling to contain the outbreak that's already claimed 631 lives.
And as Renee Filipponi tells us, with nearly 10,000 coronavirus cases, the country is now the second largest epicenter outside of China.
Video from inside a hospital pushed to the brink. The death toll continues to rise at an alarming rate in Italy, a country with the second oldest population in the world. Medical staff can't keep up.
This situation is like a bomb that explodes. Your health system, no matter how good, how efficient, how modern it is, sooner or later will collapse because the number of patients is too high for the resources we have.
The entire country is under lockdown. No public gatherings, no sporting events, and no travel. At train stations, police are checking paperwork. Only those with authorized work or family reasons are allowed to travel.
Yesterday, so she booked
Canadian Kate Andrews is a student in Milan. When the CBC spoke to her last month, she was staying put, but has now changed her mind. She left for Rome on Sunday and is now stuck there.
It's just kind of crazy. It's a weird situation. No one knows what to think or do.
She is quarantined on this farm with two friends. Because she came from Milan, the epicenter of the virus in Italy, they can't leave or contact anyone and are relying on neighbors.
We're not worried about running out of food. The neighbors are great. There's people that are there to help us, but it is a weird feeling being completely dependent on the kindness of your neighbors.
There are lines outside grocery stores which are trying to control the crowds inside. Shoppers are buying into the new reality.
When I was paying, they made sure that there was the right distance between one person and another.
The cost of this unprecedented move is massive. To offset it, the government is considering suspending bills and taxes for some. And there are now questions about how sustainable it can be, asking 60 million people to drastically change how they live for weeks at least. Renee Filipponi, CBC News, London.
And the measures in place in places like Italy are unprecedented, and the scale of outbreaks in other countries, very unclear.
As the economic impact spreads, David Cochran tells us Ottawa is facing increasing calls for action.
We recognize that there are going to be significant economic impacts for Canadians, for workers, for businesses.
To this point, the reassurances have been public, but the details largely kept private.
We're going to be talking very soon about measures that Canada's going to put forward to support people on the economic side.
It turns out very soon is Wednesday. Government sources say the Prime Minister will announce significant steps in Canada's response to COVID-19. It will include a boost to research funding to combat the virus and government's intention to waive the one-week waiting period for EI benefits for people who can't work because of the virus.
Canadians, workers who need to self-isolate to protect themselves and to protect their neighbors.
And while the provinces run the hospitals, Ottawa has the money and the financial means to respond. So sources say Trudeau's announcement will outline ways to bolster health workers and provincial health systems.
Whether it is any anticipated shortages that they might have for equipment or personal protective gear, or even in terms of human resources, additional supports that they might need in their hospitals or in their public health units. These are the kinds of conversations we're having.
The Prime Minister will also give a detailed account of what has been done behind the scenes to slow the viral spread and limit the economic contagion.
We're going to continue to act in ways recommended by the top experts, by the top medical professionals, coordinate with other levels of government, coordinate with the international community, do everything we can to keep ensuring that Canadians are kept safe.
Trudeau's announcement will deal with the immediate pressures caused by COVID-19. There will be additional measures in the upcoming budget and more after that once the full impact of the coronavirus is known. David Cochran, CBC News, Ottawa.
And every day across North America, we're seeing more restrictions, cancellations, and limitations on events and travel as officials try to buy time.
Ellen Morrow looks at some of the more sweeping measures so far to combat the spread of COVID-19.
In this New York City suburb, some of the strongest containment measures yet in the U.S. Schools closed, large gatherings banned in New Rochelle, home to most of the cases in New York State.
This is literally a matter of life and death. That's not a overly rhetorical statement.
Here's your grocery delivery.
In New Brunswick today, one of the strongest measures in Canada. Any staff or students returning from international travel anywhere must stay home from school for 2 weeks.
We expect people to comply with it because we live in a country that honors the rule of law.
This expert says banning some large events may make sense, but officials need to strike the right balance.
I think it can definitely stimulate a lot of fear in people that we're in a situation that might be worse than what we're actually experiencing right now.
There's been a domino effect with more coronavirus closures and cancellations every day. Pearl Jam postponing its North American tour. The popular Coachella Music Festival delayed until at least October. Wheel of Fortune and Jeopardy ditching their studio audiences, and major U.S. universities like Princeton and Harvard switching to online classes.
You have something this big that's just causing chaos around campus, around the world. It adds a lot of stress.
That stress spreading along with the virus, but it's prudence, not panic, officials are urging.
This is a real problem, but whether or not you should be fearful of it, you know, I don't find that a helpful response.
While Canadians wonder what cancellations and closures may be coming next, officials are reminding everyone to wash your hands often and avoid touching your face. Ellen Morrow, CBC News, Toronto.
6:35, take a look at this live shot from Surrey tonight. An eagle in the nest way up there. I didn't like how cool it got during the day today. Bundle up tonight. We're about to hit the freezing mark. Brett's going to break it all down. Coming up.
The weather update is brought to you by The Body Shop that always takes you back to your happy place. BC's favorite, Craftsman Collision, Air Miles, and Bigger Smiles.
I think it was last night at this time you were looking out going, oh, look at how light it is.
Yeah.
How nice it was.
And what a difference 24 hours can make, because it might as well have been what it looked like before we went through the time change. It's a little dark and gray out there. It will be improving for tomorrow, though. I hinted at that a little bit earlier. The sun is going to come back, but guess what? It's still winter, and there are some places that are dealing with snowfall warnings. And I want to start off with that, but take a first look, though, at what we saw this morning. I guarantee you it was not much of a sunrise. No, instead, we were greeted with a lot of low cloud, lots of showers, and then more clouds. Yeah, a very stark contrast to the way that this work week began. Monday was definitely a sunnier day, and we're going to see that again tomorrow. So we're just kind of going through a bit of a transition, but it is really important to emphasize that any travel that you may be considering, or if you know someone who's considering driving along the Coquitlam tonight, I just pretty well wouldn't. 15 to 25 centimeters of snow. There's no two ways about this. This is going to be some treacherous driving along that stretch of the highway. And this applies farther inland as well. So for places in the Kootenays, like from Creston all the way up to Caslow, it's looking like we could be seeing the same amount of snow accumulate there. And this does apply for Highway 1 between Rogers Pass and Eagle Pass as well. Now, all of this is going to be eventually clearing up throughout the day tomorrow. It's going to take a little while to get there. You're going to see most of the snow falling in the southeast of the province. We, by contrast, here on the south coast are not going to be dealing with any of that. It is just going to be a relatively sunny day. And farther to the north, we are going to be expecting a few lingering flurries, but we are in general going to be getting through a bit of a quieter weather pattern as we go through the next 2 days. Now today, definitely on the chilly side for Vancouver. Tomorrow, we're going to see our temperatures return back to a seasonal mark, sort of around that 9 or 10 degree range. And Thursday is going to be very similar, but you're going to notice into the interior, that's definitely a few degrees below seasonal for this time of year. Now, I want to mention, though, we were talking about snow. It seems to be the theme of tonight's weather. Even for us here in Metro Vancouver, I got to mention it again, there is still the slightest chance that we could be dealing with a rain-snow mix when it comes to Friday. Once again, that's going to be in the early morning hours, but with temperatures as chilly as they have been or are expected to be, it's definitely not off the table at this point in time. So we're going to have 2 fairly quiet days, lots of sun expected for Wednesday and Thursday, and then a little bit of unsettled weather to begin our weekend. But after that, it's looking pretty good, I gotta say.
Pretty good.
Yeah.
Not bad at all.
So odd to see those flurries.
I know. One day it'll change, but it's not yet. We'll get there.
Yes. All right. We heard Dr. Muthri say it on this newscast last night, and other health officials as well. There's really no certainty how long coronavirus, COVID-19 germs can last on surfaces.
And that is why you keep hearing health authorities urging everyone to stop touching faces and thoroughly wash hands, of course.
Yeah, but are you doing it right?
These two participated in a little experiment. We asked a nursing student from UBC to show us the best way to wash your hands.
Wash your hands. It sounds simple, but people have different ideas of what is actually involved in that. So we're going to conduct a little experiment and hopefully pass along some advice to make sure that we are all washing our hands properly. We brought in UBC nursing student Vida Draganovic. She's going to help us along here, and you brought some props with you.
I did. So I have a blacklight flashlight and then also some glow-in-the-dark germs to simulate germs on your hands.
And we've also brought in some CBC hosts to help us out as well.
I'm Leanne Young. I'll be washing my hands for the full 20 seconds that's recommended, along with some soap.
Mike Killeen, 10 seconds, soap and water.
I'm Brett Soderholm. I'm going to be washing my hands for 20 seconds, but with just water.
Dan Burrett, nothing.
So Vida, this is glow-in-the-dark germs. What do we do with it?
All right, so I'll shake some out on your hand there, and you'll rub them in. And then you can see with the black light that they light up quite a bit there. And so with the hand washing, you'll be able to visualize how well the soap and water gets rid of the germs.
Okay. How did I do, Vida?
I would say pretty good. I mean, the germs are only really in the dry parts of your hands, and as we'll see further on, there aren't too many.
Right.
So we're seeing a bit more of the germs, especially up along the wrists there.
So this was 10 seconds, soap and water. Clearly
not long enough.
Alrighty.
Oh, boy.
So I think this pretty clearly shows the importance of soap. I, of course, did not use any, and I think that speaks for itself.
Oh. For the record, my mother taught me much better than this. This is not washing your hands, so don't do this.
So Vita, what did we learn from this experiment?
Soap is very, very important.
What's the right way to wash your hands?
Okay, so turn on the tap, apply soap. You want to lather your palms, the backs of your hands, in between your fingers, around the wrists, the thumbs, and then the nail beds as well, all in 20 seconds.
20 seconds. Thanks.
You're welcome. Thank you.
I don't know, guys. Leanne did 20 seconds, still had some. I feel like you need to do 30 or 40 seconds at this point.
I do feel perhaps. The longer that you go, probably the better. Noticing, though, of course, the importance of actually using soap. That was a pretty learning experience for me.
Well, no one's touching Dan's hand or your hand.
No, we're going to stay away completely.
And the actual proper way to wash your hands. I mean, I don't think a lot of people, the detail that you get into with that. So
it's important stuff.
It's important. And then the reminder, don't touch your face.
Yeah.
Thanks for the lesson, guys.
There you go.
Well, it's the leading cause of death and disability for Canadians under 40. After the break, your stories, what it's like to live with a brain injury.
Every year in BC, more than 14,000 people visit emergency rooms because of concussions. From athletes to office workers to slips and falls, concussions impact all walks of life. In our series Brain Trust, we're investigating the world of concussions, CTE, and the medical research that informs their treatment. And we asked you to share your stories of living with brain injuries.
It can happen to you anywhere at any moment and just change your world.
And I think that's the biggest misconception, is because you can't see anything that people think that that doesn't exist, but it really does.
I will have a headache and all I want to do is just go home and lie down. But life doesn't allow for that sometimes.
I had gone from racing at the highest level, racing internationally for Team Canada, to crashing and burning and basically being at home by myself in Vancouver.
So I've had 5 concussions, 4 while playing high-level junior hockey and 1 after retiring from junior hockey. They're all different, so I had some while playing during the game in the sense I got hit along the boards, 1 I slipped and fell during play, and others I got one while I was in a fight.
I had crashed during my qualifier where I experienced the first concussion. I flew over my handlebars and hit the barricade. I decided that I would get back on my bike and race in the next race, which was a major mistake because I had already suffered a concussion. I took a corner way too quickly and I pedal striked, which means I hit my pedal on the ground, causing me to once again fly over my handlebars and land straight on my face.
I've had 2 concussions, and both were a result of car accidents. We were driving straight and a driver didn't stop at a stop sign, and so we were hit in the front passenger side. Airbags deployed and things had flown around, and in the second one we were rear-ended at a red light.
When I was working in an elementary school as a student school support worker and education assistant, I was working with a child who was low-functioning autistic and was a known headbutter and biter. And at lunchtime, he liked to go back and forth on a zip line, and on this particular day, it was wet. And as he was getting off of it, he started to slip, and I put my arm up to balance him. And at that point, the back of his head came whipping back, and it hit me just above the temple.
In the beginning, I didn't realize how bad my head was until that the pain of my injury sort of subsided. I was having difficulty recalling short-term memories. I had a hard time sleeping. I had to wear an eye mask and earplugs. I still have to do that to this day because I have an issue with overstimulation.
I couldn't walk straight. I was starting to become nauseous. I was losing my balance, and then the world was starting to just sip around in circles around my head.
All I remember is looking up at the score clock, and the score clock started spinning. But I played the rest of the game, and my mom came down after the game, and she said, "There's something wrong with you. I can just tell you don't look right."
When I'm reading to my daughter, sometimes I mix up words, or I'll flip-flop the letters of 2 different phrases, and I have on occasion forgotten my daughter's name. I've called her the wrong name, or sometimes I blank out and have to think for a split second, and that's quite sad.
I would say it's like having sticky notes thrown at you. Some things stick and some things just fall off. So some things will stick and some things won't. And I just have to make sure I take very detailed notes of things I want to remember, and I have to do it all on paper. I, for some reason, can't function on my phone very well.
It's just like the smallest things, like day-to-day things that never used to bother me. But in terms of physical symptoms, headaches, dizziness and stuff, I don't experience it anymore, but I did experience it up to 2 years after.
I was paying out of my pocket. I had no benefits. I had really no support from my cycling teams because I had decided to switch disciplines, and I was really on my own.
Navigating the insurance system as a result of that is also challenging. You've got lots of people who are not medical professionals making decisions about you, telling you what to do, and essentially deciding your future.
I feel like I was one of the fortunate ones in the sense that I played on a high-level sports team, so I had access to doctors and medical care that other people don't normally do.
I've lost a lot of money, salary, bonus, essentially cash. I've lost a lot of friends. My social life has changed dramatically. There's fatigue all the time. It actually delayed our decision in when we were going to have kids due to fatigue and trying different medications and things.
I'm definitely a yes kind of girl. Like, I love to go to concerts, or I love to go out for dinner and be around friends, and I love to work hard. I love to train at a high level, and with my concussion, my limits really reduced, so I had to learn to say no. I had to learn to walk away when I was feeling overwhelmed.
My youngest daughter suddenly became my caretaker. I was divorced, so I was on my own with them, and she went from being fairly independent, but also having me as her rock for both my children, to watching me deteriorate in front of her eyes.
I did feel the pressure to go back and play, or else I would have lost my spot on the team. It's almost been a bit of a blessing that I walked away when I did, because I was able to pursue my education and start a career as a registered nurse. And I've almost been a nurse for about 5 years now. And it's led me down a path where I'm starting to do my PhD and study and look at these problems that I face that I know other people are facing.
I think I would constantly remind myself, this is a symptom of my concussion. I will get through this. This is not going to last forever. And so I built a lot of mental resilience through that experience. It can feel like you're complaining, it can feel like you're a burden, it can feel like you're inconveniencing people. And so talking about it and removing that stigma is really important.
I think the biggest misconception is because you can't see a cast or crutches, or they don't have an IV, or there's no like physical outside injury like a burn, that there's nothing going on inside.
And to have someone passing judgment and saying to you, no, we're going to deny your claim, we don't believe you, or you don't fall into that category, is gut-wrenching.
There's so much given in the news about athletes and famous people who have had concussions, but there are so many people who just lead everyday lives like myself, and it impacts your life, and it impacted mine. It stopped it in a heartbeat.
Okay, it can sometimes be pretty challenging to get kids to wash their hands. Well, a toy might be the answer. We have that coming up.
Well, with all the talk of washing your hands, parents know it's easier said than done.
But a Taiwanese project has kids lining up to take their turn. Take a look. That's a robot's voice telling these students in Taiwan that washing your hands is super. The elementary students helped design the dispenser, which uses an ultrasonic sensor and Lego pieces to spray disinfectant. And from the faces of students testing out their project, this is certainly not a chore.
Whatever works.
As long as it lasts, sure.
There you go. All right, that's it for us tonight. Dan is here at 11, right after the National.
Have a good night.